So many GP trainees screw up the SCA before they even start. Why? Because they don't know how to use the 3 minutes prep time. The top scorers, they walk in with a game plan, so they already anticipate what's coming up in a case. My name is Dr. Erwin Kwun. I've had hundreds of GP trainees pass SCA. In this video, I'm going to show you how you can prime your case. Let's prime this case together. We've got an email from the district nurse. Dear GP, I've just seen Mr. James Turner as a part of my routine visit to check his wife, who had a stroke a month ago. He had been vomiting since yesterday and is struggling to keep fluids down. The district nurse has kindly checked the observation and appears that the patient is afebrile, blood pressure 115/76 sitting, and a blood pressure of 105/65 standing. The blood glucose was 6.2 and a urine analysis was normal, no evidence of ketones. I asked him to give you a call as he seemed more tired than usual and was at his normal self. Thanks, Debbie, district nurse. Let's take a look at the patient's record. James Turner, age 72. We can know that the patient has comorbidities including type 2 diabetes, essential hypertension, CKD stage 3, and adrenal insufficiency. Looking at the patient's current medications, we can see that the patient is taking metformin, lisinopril, dexamethasone, and fludrocortisone. So he had a recent review 5 months ago, and it looked like there was no specific concerns then. So how do you prime this case? It's very important that you organize your thoughts and be curious. Ask yourself, what is this case testing? So this test may be testing your ability to recognize and manage an acute presentation. You have to be anticipating your next moves, so identify the relevant information. As a patient is vomiting and has a background of adrenal insufficiency, he is at a high risk of developing Addisonian crisis. Just from the blood pressure reading, we can note that there is sign of postural hypotension, likely due to fluid depletion. We're also told the patient is tired and not himself, which make the possibility of adrenal insufficiency high on the list. So thinking about your actions and priorities, the priority here is steroid replacement, as delays could result in life-threatening adrenal crisis. In the data gathering, you might want to inquire whether the patient has been taking his medication and whether he doubled the dose of the hydrocortisone and fludrocortisone, or whether he's been given an injection to use if he's feeling unwell. You need to be considering other adjustment in the medication. For example, consideration for withholding metformin due to risk of lactic acidosis, AKI, or dehydration. Withhold lisinopril due to the worsening hypotension and AKI. If right now you're feeling overwhelmed about the SCA preparation, I've got a free gift for you. This is the SCA course that you can access. Just click the link down in the description, completely free. You can get the blueprint that hundreds of GP trainees have used to pass the SCA exam. This blueprint will help you to revise smarter instead of just working harder and practicing more cases. We need to inquire about the fluid intake, how much fluid the patient is able to drink, and whether he's still passing urine. There could be some imbalance in the electrolytes. If the vomiting is severe or persistent, then this patient might need to be admitted in hospital for fluid replacement, IV, and treatment. So just by reading the case briefing and the email from the nurse, you can already tell that this station could be challenging, as the patient's wife is also unwell, so he might be reluctant to go into the hospital. Who will take care of his wife? So you need to consider the psychosocial component of the station. When it comes to negotiation, it's very important to explain the risk to the patient and explain about the life-threatening condition if it turns out that this is actually the case. So you have to be careful that you don't prejudge a case and make assumptions before you start the consultation. Go in with an open mind, but think about what are the possibilities, challenges that you might encounter. And if, for example, the patient refuses an admission, how you're going to accommodate for that and what you're going to do instead of an admission. If the patient agrees for an admission, then you need to be discussing whether there's any family involved who could help to look after the wife, or social services might need to be involved to arrange respite care. You also need to consider how is this patient going to be transported to the hospital safely. So whether this patient would warrant an emergency services with the paramedics, or whether the patient is safe to go in with transport. So you have to be thinking about safety netting advice where appropriate, and a follow-up plan as well. So what is expected of a passing candidate here? It is to identify that Addisonian crisis early, recognize the risk of adrenal insufficiency, Prioritize a treatment, explain the need to administer treatment through the vein or through the muscles without delay, because timing is critical, as delayed treatment can be life-threatening. Also consider the sick day rules. Ensure that medications such as metformin and lisinopril are temporarily stopped due to the risk of dehydration as per the sick day rules. Consider the social context to a case. Recognize challenges for patients who are carers and plan for their specific needs and support. Lastly, ensure clear safety netting. Provide detailed guidelines on steroid replacement and make sure patients with adrenal insufficiency know when to seek further help. If you think I missed anything in the priming of this case, let me know down in the comment section. If you found this video useful, you might want to watch the success story of Dr. Lawrence Appleton. Click here to watch it. I'll see you on the other side.